Hello and welcome to GAPNA Chat, an official podcast of the Gerontological Advanced Practice Nurses Association. GAPNA Chat provides interviews and discussions with GAPNA leaders and members of the gerontological healthcare community and will focus on advocacy, policy, education, professional development, research, and clinical care for older adults. In this episode, Dr. Cassandra Von S., a gerontological nurse practitioner and member of the GAPNA communication team, talks with Dr. Natalie Baker, the current president of the Gerontological Advanced Practice Nurses Association and an associate professor at the University of Alabama at Birmingham, School of Nursing in Madison, Alabama. Dr. Baker discusses her inspiration to become a gerontological nurse, how she influenced the care of older adults through an educational grant, and some of the strategic planning being done by GAPNA's leaders to keep the association successfully moving into the future. We are pleased to present Dr. Von S.'s interview with Dr. Baker.
Hello, everyone. Thanks for joining us for GAPNA Chat. I am Dr. Sandy Von S., and I have with me today Dr. Natalie Baker. She's an associate professor at the University of Alabama, Birmingham School of Nursing. She maintains a clinical practice at a rural long-term care facility in North Alabama. Dr. Baker is currently serving as our new president of GAPNA. She was an item writer for the Gerontological Specialist exam, and it has been one of GAPNA's LACE representatives since 2014. LACE, or Licensure, Accreditation, Certification, and Education, is the collaborative communication arm of the 2008 APRN consensus model. Dr. Baker is a recognized leader in geriatrics. She's a fellow of the American Academy of Nursing and the American Association of Nurse Practitioners. She was recognized in 2018 by the National Hartford Center of Gerontological Nursing Excellence as a distinguished educator in gerontological nursing. The Alabama State Nurses Association awarded her their teaching award in 2020, and earlier this year, she was recognized by UAB School of Nursing as one of their 70 visionary leaders. Additionally, Dr. Baker is the nurse practitioner representative on the Alabama Board of Nursing and the joint committee that oversees the NP collaborative practice in Alabama. Thank you, Dr. Baker, for making time to chat with us today.
You're welcome. It is a pleasure to be here, and thank you for inviting me.
So let's start out with a question about your early career. In your early nursing life, you obtained an MSN in Occupational and Environmental Nursing from UAB. How did the 20-something-year-old Natalie Baker find her way to geriatrics?
So that's a very interesting question, and I actually will share with you some information that most people don't know about me. And that is, after being a registered nurse for about 2 years, I wanted to quit nursing. Actually, I never really wanted to be a nurse. I really wanted to be a high school biology teacher, and my mother kept telling me no because I would have a miserable life and not make a lot of money. And so, the sweet little Southern 18-year-old listened to her parents and went to nursing school. So after being a registered nurse for about 2.5 years, I really still wanted to be a high school biology teacher. So this was back in the 80s, back before we had computers. I was back on campus one day, actually registering for classes to get my master's degree in education. And I ran into a registered nurse friend of mine who happened to be on campus also. And I told her what I was doing. We had worked together before, and she told me I was stupid, that I needed to stay in nursing. And she told me about a program that the School of Nursing had where they would actually pay for my master's degree, and I would come out as a nurse practitioner in occupational health. They would pay everything, and they would pay me a monthly stipend. I was married and had a small child, and the stipend and the free tuition was very appealing to me. And honestly, I didn't even know what a nurse practitioner was, because remember, this is back in the 1980s and there weren't many nurse practitioners around. So she convinced me that day to walk down to the School of Nursing and meet with an advisor. And by the end of the day, they had sold me on that idea, and I was enrolled back at the School of Nursing as a nurse practitioner student. And I didn't even know what a nurse practitioner did. Again, the money was appealing. So fast forward 2 years later, I graduated with that occupational nurse practitioner degree. And then I realized there weren't many jobs available in my area for that level of expertise. And I wasn't willing to move. And a position came open at UAB Hospital for a nurse practitioner to be a project manager over pressure ulcer studies, research studies. And I had always loved working with patients with pressure ulcers back when I was a home health nurse. And so I applied and I got the position, and it was through the Department of General and Preventive Medicine. So I had been there for about 6 weeks when the physician, Dr. Richard Allman, who is a well-known geriatrician, then he was approached to take over the Department of Geriatrics. And he wanted to take his entire team with him to the Department of Geriatrics and to start that department at UAB. So I went with him. And I started, I continued to be a project manager over the pressure ulcers. And then the opportunity came up for me to start seeing patients 1 day a week in his clinic as a nurse practitioner. By then I had figured out what a nurse practitioner was. And so it just kind of evolved. It just kind of fell in my lap. And I loved the geriatric patients so much that after about 3 years working with him, then I was approached by a physician in a rural area, and he needed a nurse practitioner to see his geriatric patients in the morning in the clinic, and then go do some home visits, and then go to the nursing home in the afternoon. That was my perfect job description. So that's kind of how I landed in geriatrics back in the early 1990s and have never looked back.
Our patients and GAPNA is very fortunate that you ran into your friend on campus years ago. So it was definitely fate that got you on the right track. We're better for having you in our profession. You were part of a team that received an advanced education grant from Hersa. How have you been able to use that to influence the care of older adults?
That was another opportunity, Sandy, where just a door opened and I walked through. I feel like my entire career is just full of opportunities that, just kind of landed in my lap. I had been a clinician in nursing homes for many years and had never even thought about academia. And I decided to go back and get my doctorate degree back in 2010. And I did. And my DNP project was on long-term care. And somehow the dean of the nursing school got to know me. I will say she somewhat discovered me and continued to get me to join the School of Nursing upon graduation. Again, I had no aspirations to be in academia. So back in 2011, I agreed to join the faculty there at the School of Nursing. And she primarily hired me because of my geriatric clinical knowledge. And they had this Hersa grant. Remember, in 2010, it's just 2 years after the APRN consensus model comes out, where they pretty much do away with geriatrics as a recognized population. And they're working on trying to merge adult and gero into one curricula. So the School of Nursing had an education Hersa grant to do that. And so I was primarily hired to come in and actually contribute because of my geriatric knowledge. And so I had the wonderful opportunity to get there on the ground level and start working on that. So then what I did was I then created geriatric standalone programs for our students who could bridge and then actually take the new adult gero NP program before we officially had an adult gero NP curricula there at the School of Nursing. And we were one of the first schools in the country to be able to have our students qualify to take the new adult Gero MP exam. And so I just took all of my geriatric knowledge from clinical side, and then from what I learned in teaching in the Hersa grant. I later became the specialty track coordinator of our program. I'm no longer in that role, but I have just fought hard to make sure that we do not dilute our geriatric content in our curricula there at the School of Nursing. In fact, when we did officially merge, I made sure that all of our students have at least 100 hours of geriatric practicums before they graduate from our program. And unfortunately, the accrediting bodies do not require a specific number of geriatric practicums before they graduate. But at the School of Nursing there at UAB, we do require that 100 hours. And I think that that was one thing I've been able to contribute, is just recognizing the importance of all of our adult Gero students being required to spend time with geriatric patients.
I think you're absolutely right. I think that specialty knowledge that we have, we need to make sure that it's available to the upcoming classes of advanced practice nurses and not just be relegated to a slide at the end of every presentation, age-specific changes. So that's important that you're advocating for that.
And I would go a step further and say that ideally, I would like all students to be required to have a rotation through a long-term care facility. I know that while that is a great plan, unfortunately, sometimes we can't find the preceptors there in the long-term care facilities, or we get feedback from students who say the preceptor didn't really know what they were doing with geriatric patients, which is so sad. So, there are so many opportunities that we have to continue to promote that need to not lose the specialty knowledge, because as we know, we are a dying breed. We no longer offer a GMP program, and we have to make sure that the content does not get lost in the adult Gero combined curricula.
Absolutely right. You've published several manuscripts about some creative teaching ways related to pressure injuries and skin issues. Tell us how you're using gamification and simulation to enhance the knowledge acquisition for NP students at UAB.
That's a great question. Also, I have a couple of different, responses to that. As far as the article that I published regarding debridement for pressure injuries or pressure ulcers, a lot of people don't realize that one of the competencies for adult Gero NP students is to learn debridement. And how do you learn debridement if you can't do a hands-on activity? And I could not find anything published or, talk to my colleagues. I just could not come up with any type of simulation to actually teach how do you use the scalpel and debride a scar for purposes of them being competent to do so in the clinical setting. So I decided one day I would go to my local grocery store and see if I couldn't figure out, could I find a piece of meat that we could do? And my husband actually was with me that day, and he sat in the car and he said, "No, honey, you can go in there and you can figure this one out." And I stood at that meat counter for, I don't know, Sandy, it was a while. And I would look at different pieces of meat and I would be thinking, what can I do? And a ham hock caught my eye. Now, a lot of people may not know what a ham hock is, but in the South, it's a delicacy and we use it a lot for seasoning. And it is also known as pickled pig's feet. And so it's a pickled process where then the outer part of the skin of the pig's foot is actually dried out and basically desiccated. And it's very, very thick. And that caught my eye there in the meat counter. And I started caressing the ham hock through the, saran wrap, the wrapper. I'm sure people there standing next to me thought this woman is crazy. And I thought, that feels like eschar on a pressure injury. So I bought the hem hock. I went out to the car. I was so excited. I showed it to my husband. He looked at me and he said, "Natalie, you are sick." And I said, no, this is going to work. I know this will. And so the next day I went to the nursing home and got a scalpel and came back to my house. And sure enough, it feels just like eschar, cutting through eschar. So now every year, all of my students, when they come on site for their last intensive, they get a lecture on how to care for pressure injuries and also how to do debridement. And they get the experience of knowing what it feels like to cut through dead skin. And they really enjoy that activity. And it's just been a wonderful experience. And in fact, our family nurse practitioner program has also used that simulation. But then as far as gamification, today's adult students learn differently. And because they are growing up now with video gaming, we are forced to change how we deliver the content of our information in school. And our university actually developed a game called Kaizen. And it was meant to be an app that you could download, and it would have clinical questions. You would read the clinical question, you would immediately answer the question, and you would get immediate feedback. And you can assign badges, you can assign points to it, you can have a leaderboard, you can do competitions. And so I was the first one to bring it to the School of Nursing for our nurse practitioner students. And that's something else we do every year, their last semester. And that's helping prepare them for their national boards. They get to compete against each other. And in fact, I randomly put them in teams, and the top team gets a couple of extra points. And it's just a lot of fun, but yet at the same time, they're learning and they're reinforcing the information that they've learned throughout the year.
You've really been very creative, and I see where that innovation and that visionary award comes from, because we do need to, rethink just, didactic, delivering knowledge that way.
We do. And I also took a unfolding case study that the National League for Nursing developed several years ago. They developed it for undergraduate students. And they developed one about an older man who lives alone, and he has diabetes, and he develops a diabetic foot ulcer. And I took that simulation for undergrads and actually revamped it for my NP students and turned it into a case study series. And I added to it to where the students have to answer questions, and they follow him over a course of time. And they have different nurse practitioner encounters, with this patient as his condition declines. He ends up having to go into the hospital. Of course, he gets an infected foot ulcer. And, he goes into the hospital. And then when he comes out of the hospital, they have to plan a transitional care, plan for him. Does he go into the nursing home? Does he go to assisted living? Does he stay at home? And they have to pull in interprofessional disciplines to help Red. And I was fortunate enough last year to receive a GAPNA Foundation grant. And I actually developed a self-efficacy tool. And the grant money went to implement this study with the students. They completed the self-efficacy tools. And the data actually showed that having some type of unfolding case study following an older adult over several weeks as his condition changes, and you're having to also manipulate all of his different comorbidities, that they felt more confident in caring for older adults after they completed that unfolding case study. So yes, there's all kinds of innovative techniques that we can use to help teach our students the geriatric content and help improve their self-confidence.
That is much more real life, like a panel of patients would be, instead of just a sporadic clinical visit with a preceptor. So that really helps, pull everything together. That's wonderful. I have a question for you about what you recently shared in the Clinical Advisor. You provided a review of literature on prescribing and medications, at transition, since we're talking about that and how vulnerable our folks are. How did this collaboration with the Clinical Advisor come about?
GAPNA is so fortunate to be working with the national office, AJJ. AJJ has just wonderful resources. And their director of media and communications, Janet, she actually talked to a clinical advisor and suggested that perhaps they give us some dedicated space in their journal that they provide I think it comes out every month, and have a geriatric focus on review of the literature. And so if it wasn't for GAPNA's association with AJJ, we would not have the opportunity to increase the readership's knowledge of geriatrics. And the clinical advisor goes out to all nurse practitioners as well as PAs. So we have a very wide audience. And I think for 1 year, we contributed monthly. We divided it up among different board members to do a column each month. We are now doing quarterly, and we look forward to continuing that association with clinical advisor.
That's excellent. They've always been a great resource of mine. I look forward to, the skin issues and some of the complex cases that they have. So that's wonderful. This was a first for GAPNA this year. Many, many firsts since we're pandemic, but the hybrid conference this year. How do you think it went?
I personally think we had a grand slam. I think we did great. We had very few technical issues. I'm not aware of any major technical issues. It was an opportunity for those who felt comfortable enough to travel and again attend a live conference. And it was also an opportunity for those who either still were not comfortable in traveling, during this COVID pandemic, or perhaps their employer would not allow them to travel. So they also could still participate in our annual conference. We received very good feedback from attendees. And I think that maybe hybrid conferences across the board may be something that is a new normal for many organizations. Back in March of 2021, we did our pharmacology conference. Of course, it was all online. It was virtual. It was very well received. But we also knew that we had a lot of members who really wanted to get back in person because, as you know, sometimes there's synergy and there's networking that can only happen in a room when you're face to face. And so we felt strongly to try to meet the needs of all of our members for the annual conference. And so we decided to do the hybrid, and we have no regrets that we did it. We think it was very, very successful. And we acknowledge that it may be a new normal for many months or possibly years to come. Who knows?
And the team did a beautiful job of engaging the Zoom participants during the live presentations. I thought it was just a beautiful blend of questions and interactions and discussions that, I had an opportunity to participate in with people that were doing the virtual
I agree.
platform. They did a beautiful job.
I agree. Ideally, we would like to have been able to have breakout sessions so that even with the concurrent sessions, our virtual attendees could choose. But unfortunately, just due to the cost, we could not have the virtual component set up in every single room. We could only limit it to one room because of cost. And I think that's our only regret is, that we could not provide everything live. However, even the virtual attendees after the conference, then they still had access to those other concurrent sessions that were not captured live, but of course they were recorded. So then the members could then go back who had attended virtually, they could go back and then at least get that content. So yes, I think it was a win-win for everyone. And Sandy, I thank you for that question. And we look forward to hearing from our members and what their needs are. And we strive to try to meet those needs.
And I think each time we'll get better. And I'm excited to see how Philadelphia in March goes for us. So I'll be excited about that. I know that the leadership team is working with the Riggs Enterprise Corporation for strategic planning. Can you give us any kind of hints about the future, the long range and short range for GAPNA?
I don't know if it's any hints, but I can tell you a little bit about the process and what we hope to accomplish. Ideally, all organizations should do strategic planning every 3 to 5 years. And we had slated to do our strategic planning back in 2020. And we all know what happened in 2020. Life came to a screeching halt. And so we put it off a year because we felt like that for strategic planning, you really need to be in a room. You really need to have that, just ability to feed off each other when you're all facing each other. And so we put it off to the 2021-2022 year. And we are looking forward to working with Riggs Enterprise. We selected his company because of his experience working with like-minded organizations doing strategic planning. So hopefully everyone will have completed the survey. We're depending on members to give the feedback, because the members of our organization will drive the conversation. In March, when we get together to do the strategic planning, the board of directors and a few other selected leaders throughout GAPNA will go to Philadelphia 2 days prior to the pharmacology conference, and we will have 2 days of strategic planning sessions with Riggs Enterprises. And, we will be looking at everything from our mission, our values, the changing APRN landscape. Nothing is off the table, nor do we go in with any preconceived ideas. We want to continue to meet the needs of the GAPNA members, and we want to continue to be the premier organization for all APRNs caring for older adults. And so I guess that would be our driving goals going into the strategic planning. And then we look forward to what evolves during that 2-day process.
It's an exciting time to be a GAPNA member, to be forward thinkers, and it's exciting. Well, our time is just about at its end. Is there anything additional that you would like to share with our audience?
I would just encourage everyone to find a committee or a SIG or a local chapter and get more involved with GAPNA. We know everyone is very, very busy. We have some members who are, members of committees, and they know they can't commit to the committee meeting time once a month, but they still stay in touch with the chair and they still contribute. They are still doing things as their schedule allows. And so it would be my goal as president to be able to say that 100% of all of our members just do something, that they get engaged at whatever level of time, commitment, their comfort level, and just do something. Even if it's being a regular contributor to the GAPNA exchange, anyone can post on the open forum. Put your thoughts and ideas in there. Let's use our members as, our peers as our resources and our networking, because we are a group of individuals that collectively are making a difference to improve the care of older adults, and every member counts.
Yes, how true. Great opportunity to network with the GAPNA Exchange. I would like to thank you again, Dr. Baker, for carving out some time to have this conversation with us today, and look forward to the next year and what GAPNA will be doing to improve the care of our older adults. So thank you again.
Thank you. It's been a pleasure.
GAPNA Chat is owned and produced by the Gerontological Advanced Practice Nurses Association. All rights reserved. No portion of this podcast may be used without written permission. Dr. Natalie Baker is the 2021-2022 President of the Gerontological Advanced Practice Nurses Association and an Associate Professor at the University of Alabama at Birmingham School of Nursing in Madison, Alabama. Dr. Cassandra is the Nurses Improving Care for Health System Elders Coordinator Geriatric Oncology at the Moffitt Center in Tampa, Florida. She is a member of the Gerontological Advanced Practice Nurses Association communication team and is a host of the GAPNA Chat podcast series. For archived episodes of GAPNA Chat and to learn more about the Gerontological Advanced Practice Nurses Association, visit gapna.org. You can also subscribe to GAPNA Chat on Apple Podcasts, Google Podcasts, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and everywhere podcasts are found.